Hi, everyone. My name is Lorena Carroll, and I am an Ayurveda wellness consultant. I'm also a certified teacher of transcendental meditation. It's so nice to be here with you this evening. So my topic for this evening is how Ayurveda medicine complements modern medicine. Because I wanted to I've talked about this topic in many other videos, but I wanted to talk about it in a different way this time because I don't want anybody that's studying Ayurvedic medicine for the first time to think that anybody that's interested in holistic or natural forms of meditation or forms of medicine should feel that we don't want to integrate also modern medicine into that we're completely against modern medicine. This is really an important point. I believe that Ayurveda medicine greatly complements modern medicine if used properly. And I want to go into a few areas in that way. But first, I want to talk about many doctors that are medical doctors that also have studied Ayurveda medicine and written wonderful books. One of the doctors is Dr. Vasant Lad. I have mentioned him before in previous videos. He was my first Ayurveda physician, and he is located in Albuquerque, New Mexico. And because of him, I am where I am today in terms of Ayurveda in my life. He inspired me greatly with his gentleness of nature and just by sharing many cooking classes and his great wisdom with me every time I would go and have a consultation with him. So Dr. Vasant Lad, in one of his books, also explains that in India, they have two wings of the hospital. One is an Ayurveda wing and one is modern medicine. And so when you go to the hospital, if you're really in need of medications and modern medicine, you'll go to that wing. But if you have something that's mild, they will first try and treat it with Ayurveda medicine, which I feel is so wise. And that's where I think the complementary aspect comes in, that you can go and first see, well, let's try out some herbal preparations, let's try diet, and see how that works before going very harsh or strong with maybe medicines that you don't necessarily need. Because I've talked about Ayurveda as being the ability for the body and allowing the body to enliven its own inner intelligence. And often, when we get sick, people are just so quick to jump to taking some medication because it's quick, it's easy, you go get something over the counter. But over time, they have very negative side effects. So if you use modern medicine in moderation so that you only use medications when absolutely necessary, and after first trying Ayurveda medicine, then you will have greater longevity, greater health. There is research that shows if you strictly do everything that your doctor tells you to do, and you rely solely on modern medicine, that those people are actually less healthy than those that do not always do what their doctor tells them. Now, I realize that's conflicting, and I'm not suggesting that you don't do what your doctor tells you, but I am suggesting that you get several opinions. If you have some serious issue, you get several opinions. And you also take a look at diet, lifestyle. That is what Ayurveda medicine is all about. I've talked about the three doshas, Vata, Pitta, Kapha. It's very important to know which dosha you are and to get checked periodically with your pulse, doing pulse diagnosis to see, is there an imbalance in the physiology in a particular season or due to some thing that you're going through. So very, very important. So I recommend in terms of Dr. Ladd, that you can even read some of his books where he talks a lot about Ayurveda. But the main thing is that a lot of these doctors, such as Dr. Ladd, also I wanted to show you some wonderful books here. Dr. Nancy Lonsdorf is another wonderful medical doctor who she does integrative medicine in Fairfield, Iowa, and she also mainly is really an integrative physician where she will have her patients following a better diet, Ayurveda herbs, meditation, things like that. As a last resort, she will obviously refer her patients to medications if needed. And we say if needed most likely life or death situation, kind of seeing, is your health in danger if you do not take the medications? And that really should be the basis for when we take medications and how Ayurveda can complement that. So Nancy Lazar has a wonderful book, The Ageless Woman, and she has many other books I definitely recommend reading. And I am recommending medical doctors because I think it's important that when we talk about Ayurveda medicine, that you know that these highly trained medical doctors are also using Ayurveda medicine and how important that is. This is Kumuda Reddy. She and Linda Agnes wrote this book for a Blissful Baby, and she has many other books out. She's a pediatrician, so she has wonderful information for parents if you have children, so you can have some information about that. And also Kulreet Chaudhry, she's also a medical doctor. She has a wonderful story. She wrote The Prime, and she has a wonderful story of how she was starting to get migraines, and she was feeling horrible. And as a neurologist, she was often recommending medications for her patients with migraines. And so she kind of went through her process of not feeling well with the medications that she was giving her patients. And it was sort of like an epiphany for her. Oh my goodness, I feel horrible. And I'm giving this, stuff to my patients. I'm giving this medication to my patients and I feel horrible. And so they must feel horrible. And she felt terrible about that because she had never taken medications before. And that's when she started to go get more interested in Ayurveda medicine, and she actually took a course in Ayurveda and now is offering. And she's involved now in research, but for many years she was offering Ayurveda treatment for her patients as well. So there are two areas when you have these medical doctors that sort of branch off and sort of have this other area of more holistic approach. That really is the complementary aspect. There is a CAM, Complementary Alternative Medicine. This is another organization where doctors that have been medically trained, they decide, you know what, I want to offer my patients other modalities of healthcare because they see the perils of modern medicine. They see that when people take medications, they see themselves the negative side effects. I have talked to dozens of doctors. I teach, as many of you know, Transcendental Meditation. I've taught dozens of doctors the technique, and they all say, I really, really need to offer also better diet. And they often don't have the time. It's not that doctors don't want to. It's just that they often don't have the time to devote. I offer 75-minute consultations where I go over really diet and lifestyle recommendations, and it's a whole hour. Now, a lot of my YouTube videos has a lot of that information, but I like to give people an overview of what is Ayurveda and really go into detail of what type of a diet that they could have for really, truly healthy living. And so this is important, but doctors don't have the time. They are often under pressure, especially if they're not in private practice and they work sort of in a hospital setting where they're not their own boss. Then they have to get the patients in and out. They're often overbooked. And this is where today in our society, modern medicine is very detrimental for our health in the sense that they only treat you once you are already sick. Most of the time, you're not even able to get maybe it's an ultrasound, or maybe it's just some type of x-ray that you need, or some type of a test, maybe an MRI. But until you show symptoms, usually at that point, it's too late. So it's really hard for someone, an individual who is not enlightened on Ayurveda medicine and healthy living and diet, and sort of succumbing to the ideas and the recommendations of their doctor. They often run from doctor to doctor, and sometimes the doctors don't even know how to heal them because maybe their symptoms have not manifested in such an acute way that they can actually know what is wrong with them. And so now we have more modern medicine testing, and that is helping a lot. So often we will, get to the root of the problem. but often it's too late because you need to have a certain level of the disease in order for it to be, to get the sort of permission from the insurance companies and from the doctors to go ahead with a lot of these testings. So this is really not good, healthcare, and this is why in our country today we just have a very, very expensive, not inefficient, not sustainable healthcare system, and that needs to change. And what I would like to do, and sort of my dream, is to have more holistic healthcare clinics and hospitals where people can go. They can get Ayurveda massage, they can get Panchakarma, the detoxification treatment, they can have a Ayurveda wellness consultation, learn transcendental meditation, learn how to do yoga, and that they can really be empowered to take care of their own health with actual things that work. Now, I'm not saying that it's going to be a miracle for them or somebody may never get cancer. We don't want to be naive and think that if we do everything holistically and do everything right, that we may live a life completely free of disease. There are things that could happen, but the chances are much less likely. And also the quality of life is going to be much greater. I see people that practice Ayurveda medicine that actually are like myself, maybe either a wellness consultant or they just have been on their own self-study and going to Ayurveda wellness consultants and gathering more information, how to take care of themselves, how to take care of their family. And they look good, they feel good, and they can really nip things in the bud. Even if things start to manifest, they catch it right before. And that's what Ayurveda is about, preventing disease before it arises. Modern medicine is not about that. Doctors can only treat you once you have cancer. If doctors were so good at preventing cancer, then it wouldn't be an epidemic. If doctors were so good at helping with heart disease and high blood pressure and anxiety and depression, there wouldn't be an epidemic of it. But there is an epidemic of all disease that we must really face that reality. And so modern medicine alone, any doctor will tell you, and I think I've mentioned in previous videos, Dr. Hyman, I also love his books, and he talks about the fact that, food is medicine. Don't do everything your doctor says. If you're not eating well, your doctor cannot help you. But that brings up the other point that surgeries and medicines are a part of Ayurveda medicine in the sense that if there is an emergency that you can utilize it. So we do have in the ancient Vedic texts, Sushruta and Charak Samhita, we do have surgeries. And it's great if you hurt your knee and you break a leg, you can go to the doctor. If you need a knee replacement, you need a hip replacement. But if you follow a healthy diet and lifestyle, then you most likely won't need a knee replacement. You most likely won't need all these things. But should you? Because as I mentioned, genetics and all of these other factors come into play when we're talking about our health. So we can't really judge all the time from one day to the next what might happen. And so we want to have modern medicine there as a backup. And we should feel grateful of our advances. But again, it's the advances of, oh, look at how cancer is being cured so many times. But do you really hear how many times cancer is not helping, that people go through chemotherapy, which is a very aggressive treatment? And it does work for the most part, but often the cancer will come back. And we hear of people having cancer 2 and 3 times because they're not changing their diet and lifestyle. If you even get cancer once and you do the chemo, there's a way that you don't have to have it come back again if you really follow a good diet and lifestyle, but you need to know what that is. And it's not easy. I can really empathize with people that have not studied Ayurveda medicine or don't know much about health, but you can learn it. It's easy. And you just take baby steps. You don't have to, go into it all at once and think you have to change everything. Just start making little changes in your diet, in your lifestyle, and they can really make a huge, huge transformation. So that's what I really recommend to people. and make sure that you can have that balance. Go to the doctor once a year at least, and if your doctor recommends more because maybe you have a family history of some disease, so the doctor might say, okay, I think you need to come every 6 months. Do listen to your doctor in terms of coming for follow-ups and to make sure that everything is okay. But if the doctor you feel starts to put you on medication and you're against that, then seek Ayurveda assistance with it. You can find a wellness consultant in your area. You can look on my website. I can, speak with you. I can put you in touch with people. If I can't help you, then I put you in touch with people. But it's very important to have a yearly physical. That's where Ayurveda complements modern medicine, that you can get that physical, get your blood work done. I've mentioned this in previous videos: D3, B12, iron, calcium. You do want to see what are my levels, and those D3 levels can change very quickly. And if you're deficient in D3, you could just have a horrific time with your health, and you don't want that. So go once a year, get your blood work done, and take that blood work to an Ayurveda wellness consultant, because often they will know what to do with that information. It's called the metabolic paneling, and you go through and you have all the different vitamins and the thyroid, cholesterol, blood pressure, all of that. They measure it and they see where you're at, because often the nurses or the doctors that are doing this, if it's not really, really low, or if you're not really low or deficient, if you're sort of just a little below, they might just say, oh, you're fine and everything's okay. But suppose you're just a little bit under in D3, and they don't really tell you that, and they don't say, you're a little bit low and we're coming into the winter time, maybe you should increase the D3. I have found that psychologists and medical doctors don't really take these levels seriously. And I think for anxiety and depression and just low mood and low energy, B3 and B12 and iron, those are all factors in it. So before I want to, when I talk to somebody about Ayurveda medicine and about their health, I always say, get me that metabolic paneling. Then I can see. And that's definitely where we're complementing. Where Ayurveda medicine is utilizing modern medicine to take the blood, measure the blood, come back and see how it is. Let's talk about some of the x-rays and things that I do think you need to proceed with caution, and try to find a medical doctor that is also trained in holistic medicine. Maybe they are a chiropractor, or maybe they are a medical doctor that has studied Ayurvedic medicine. We have, all over the country, we have these types of people. And I think it's good to have a doctor that is really open to other things. For example, I think it's okay to go and have your mammogram and have your colonoscopies and all of those things. That's fine. However, you must take into consideration that there are other ways of, you can do a thermography, you can do, there's electrodermal testing, and there are other ways, and maybe the frequency of how you do those things, depending upon if it's hereditary or not. If you don't have a history of breast cancer in your family or colon cancer, you may want to think about the frequency that these health insurance companies and doctors tell you to do this, because it is a money-making business. So they want to tell you, okay, you should have it maybe once a year. But if, it may be too invasive. I mean, every time you get a colonoscopy and they put you in that twilight, first of all, they flood you with these chemicals to eliminate everything. So you've got all these chemicals, and who wants to do that once a year or once every 5 years? Flood the body with chemicals. You could do senna leaf. You could do a senna leaf laxative as opposed to what they give you. Maybe you could do, maybe you don't need to be in the twilight. Maybe the pain isn't that bad. I haven't had one yet, so I don't know, but maybe the pain isn't that bad. And so there might be ways, and you can also, there's other ways in Ayurveda that you could maybe look at the stool directly if you don't want to have that invasiveness, of the colonoscopy. It just really depends. And the mammograms are the same way. With the mammograms, you are getting so much radiation. And I believe that if over time you get too many, you could end up with a false positive, which is, everybody's nightmare, and it's happened way too often. Or it could cause so much radiation, and that could harm you negatively. So again, it's just a matter of, do you want to, you know, not get them as often, depending upon the history. These are things that you have to talk to a doctor about, but maybe somebody that's more open holistically. And look, let's face it, there's a gamble in everything you do. You find out you need open heart surgery, nobody can guarantee the success of the outcome. So it's always a risk. And anytime you decide, you know what, I have some particular, ailment, I'm going to try to do it more naturally for, a couple of weeks. Sure, there's always a risk. There are some people that have had cancer and they go to some clinics and they get healed and everything's fine. There's other people, they go to the clinics and the natural approach of eliminating the cancer doesn't work. It's a gamble either way, but it's your own choice. And maybe it's good to state that you can have the choice and you can try sometimes to do it naturally if that's what you prefer, and to discuss that with your doctor, or maybe to do medications along with Ayurveda preparations and waiting until the nervous system can heal from whatever issue is going on, and then weaning off of the medications of modern medicine. So there's a vast array of possibilities, and there's so much out there that's unexplored. Anybody that has studied Ayurvedic medicine and claims to be a wellness consultant or an Ayurvedic physician or expert or whatever you want to call it, we are still all learning. Nobody knows everything. It's a process and it's a journey. And it's fascinating to me as we progress in modern medicine. If somebody is solely interested in modern medicine and they put all their eggs in one basket, so to speak, and they just do everything the modern medicine way, chances are it's not going to be a good outcome. On the other hand, with Ayurveda, as I was mentioning before, if there are people that are interested, like I'm a wellness consultant, but I go to a doctor every year, and I want to know what my numbers are, and I want to research if I have some issue going on. I want to research it and know why, and make sure that it's nothing serious. And if I did need surgery or medications, I would do it, but temporarily. Then I would say, okay, so if some issue came up, fortunately it hasn't happened yet, so I'm, feeling good about that. I think it is because of the way I've eaten and the way I've lived my life. But should something happen, I would not be opposed in either direction. But you can't be too much one way. There are people that follow just holistic medicine and may be a little stubborn when they might need to have some medication just for a short while, and then go back, to herbal things. And so it's really a balance. And I think the whole idea for me in this presentation to you this evening is to open your mind. I think it's really important not to be closed-minded when it comes to your health, that there are so many possibilities of what you could do to heal the body that's natural. And sometimes even Ayurveda wellness consultants and Ayurveda experts, they have to try different things. So if you go to somebody who's a holistic or Ayurvedic wellness consultant, and maybe you feel you didn't get the relief you wanted right away, don't be mad at them. It's not like they don't know what they're doing. It's just that the body is so complex, and it might take different herbs. Sometimes that's just how it is in natural medicine, in Ayurveda. You just take different herbs, and then suddenly, oh, that worked. And so for yourself, you have to be open. It is a lot of work. I kind of, as I'm getting involved in more and more into Ayurveda medicine and learning more myself and keeping abreast of what's out there in terms of Ayurveda medicine and modern medicine, I'm just even overwhelmed at the complexity of the nervous system, at the complexity of trying to heal someone naturally. There is no sure answer. We can't just say, okay, this is going to work in every single case. And so that takes from the patient, let's say, of Ayurveda, or the patient of Ayurveda, we have to say, take care and try to not get frustrated with the process and just go, okay, that didn't work. Okay, now I'm going to try this, and don't give up, because if you just are starting on the Ayurveda journey and maybe you've been out of balance for a while, it's going to take some time. And you finally got that under control, that one issue you had, and now you're working on another issue, and oh, maybe that issue comes up again. And so it's really an interesting, sort of like a juggling act. And from your side, just persevere. That is my high recommendation, is to persevere. Don't get disappointed if something doesn't work right away. I often, when I see clients, I get frustrated because I am trying to help them, but they want a quick fix. And that's where we have to understand that modern medicine can temporarily give you a quick fix. Very easy. You have something going on. Often you take antibiotics, you take some medication. If you're lucky, it'll work right away. But it has done most likely some damage to some other part of the body. May have helped one part, did a little damage. Now, if you're not taking that medication on a regular basis, you'll probably heal from it and recover. But when you're taking medications on an ongoing basis, definitely they could cause some damage. So you have to be careful. So modern medicine is not foolproof. These doctors are not like God, and they can cure you all the time, every time. So in terms of Ayurveda medicine, you have to be very patient with the person that's working with you, because they need time to figure things out, and it's not going to happen in one consultation. I always recommend to my clients, and I call them clients rather than patients because it sounds like a nicer word, that you're not sick, you're treating someone, to make them healthy. I feel it's so important to know right away, and a lot of the content that I'm giving you in this presentation is going to go in a book that I'm designing. And this book is it's like a handbook, a guidebook that you can go to if you have specific health issues and you want to address them. You'll know where to go, and you'll know how to make the maximum of Ayurveda medicine in terms of your knowledge, gaining knowledge, just sort of every day, every week, every month. You just add more tools to your toolbox. How can I make myself healthier? Not beat yourself up if you've got kind of go off the wagon a little bit and get off into a bad routine of maybe poor eating for a while. Then you just go back to it. But the whole idea is to keep going, and to try to improve. Because if you give up and you start going back to your old ways of just not caring and just eating what you want and not taking care and giving up because it's too much work and too much stress going to, one Ayurveda physician or going from doctor to doctor, you have no choice, really. You have to do it. Because if not, then whatever ailment that you have that's bothering you, that may be chronic, especially for chronic illnesses, people really give up. But you can't give up, because it can just be one day, suddenly, something works, and then you're feeling much, much better, and then So this is sort of my advice to you with how Ayurveda can complement modern medicine. Modern medicine can also complement Ayurveda, that we use both sensibly, hand in hand. We don't have to, be so negative about one or the other if we feel that it hasn't worked for us all the time, every time. We are our own physician. That is very clear. Nobody can heal you. You can only heal yourself. So it's your job. Be very careful not to put your health solely in the hands of even an Ayurveda wellness consultant or a physician. Whatever they tell you to do, you try. If it's not working, you go back to them and say, I don't think it's working. And then you get something else. And this is where you work together, hand in hand, to see in your particular case what may or may not work. And then you have to, and it takes work because you have to be more observant of what's going on and maybe journal things because sometimes you forget. Often you'll go to the doctor, you go to, have a consultation and they're asking you so many questions and you feel, oh, I don't know. You're kind of put on the spot. Do I really know what's going on? Do I remember how I was feeling 2 days ago? Or is that word, they'll ask you like on a scale of 0 to 10, what is the pain level or what level of discomfort? And it's often hard to articulate that all the time. We're so busy in our lives, we don't always recognize it. So I'm going to just wrap up here a little bit and close with telling you to trust in this Ayurveda medicine. I've been doing it for over 30 years. It's not always easy in terms of getting the maximum, out of your health with it because sometimes it does take trial and tribulation, but you will be absolutely thrilled with the results that you get if you just keep at it and you persevere. True health will be yours. Thank you so much for listening this evening, and I do hope you'll join us next time. As many of you know, every Thursday evening at 8 p.m., I'm live doing a wellness webinar, and you can join anytime. But I also have a YouTube video, and I have at the end of this, you're going to see on the screen my Ayurveda website, and that's www.Ayurveda, AYURVEDA, consultant.com. Please feel free to call me or email me. I'd love to hear from you, hear your thoughts, and have a wonderful evening.